Okay, hi everyone again. I'm Eileen Monyok, and it's now my honor to introduce our video speaker, Pramilla Jayapal. And to be perfectly honest, I had been in contact with her scheduler, and they gave us some pretty strong consideration that, she considered coming to speak. And as you know, she is the sponsor of the House Medicare for All bill, so she's very supportive of our cause, which you'll hear more about. So in introducing Representative Jayapal, just wanted to say that she is Chair Emerita of the Congressional Progressive Caucus, which represents nearly 50% of the entire Democratic caucus. And as I mentioned, she's the lead sponsor of the Medicare for All bill in the House, and this was just recently reintroduced. She was first elected in 2016, and Congressman Jayapal is now serving her fifth term in Congress representing Washington's 7th District. This encompasses Seattle and the surrounding areas. She's the first South Asian American woman elected to the U.S. House of Representatives, and one of only 24 naturalized citizens currently serving in the U.S. Congress. Representative Jayapal was born in India. She grew up in India, Indonesia, and Singapore. She came to the U.S. by herself at the age of 16 to attend college at Georgetown University. Then she later received her MBA from Northwestern University. Prior to serving in elected office, Congresswoman Jayapal spent nearly 20 years working internationally and domestically in global public health and development, and as an award-winning national advocate for women's, immigrant, civil, and human rights. It is now my honor to introduce our next speaker via video, Representative Pramilla Jayapal.
I'm Congresswoman Pramilla Jayapal, and I'm honored to represent Washington's 7th Congressional District in the House of Representatives. Thank you so much to the Colorado Foundation for Universal Healthcare for inviting me to share a few words with you all today as you gather for your annual conference. It is no secret that America's healthcare system is broken. In the richest country in the world, it is criminal that 85 million Americans are uninsured or underinsured, and that 1 in 3 Americans has medical debt totaling $220 billion. And that's all while the top 5 private insurance companies have pocketed $370 billion in profits over the last decade. That's exactly why I recently reintroduced my Medicare for All bill with Senator Bernie Sanders and Congresswoman Debbie Dingell. It creates a universal healthcare system where everyone is in and no one is out. Our legislation is the only bill in Congress that outlines exactly how we would get to quality, comprehensive, affordable healthcare. It expands and improves Medicare to cover medical, reproductive, dental, hearing, vision care, as well as long-term care. Our improved Medicare for All would finally put patients over profits, with healthcare when you need it, where you need it, from the day you're born to the day you die. Now, this isn't just good policy, it is actually incredibly popular too. More than 70% of Americans support this legislation, and over 100 cities and counties have passed their own Medicare for All resolutions. Now, getting this legislation passed is going to be an uphill battle. We have to build support from the ground up. No matter if we're talking about state or federal single-payer healthcare, we are talking about the same principle, healthcare being a human right. And state-based plans show us what can be done in the effort to provide comprehensive healthcare at a large scale, serving as a model for what a country with guaranteed healthcare could look like. They also give us momentum in our push for federal Medicare for All legislation. Now, some states are going to refuse to adopt these plans, hurting some of our most underserved and marginalized communities. And that's why we also have to continue to fight to pass Medicare for All at the national level and guarantee healthcare as a human right to every single American. So, as we fight forward for the healthcare system, we also have to be willing to fight back against the constant attacks from Trump and Republicans on the healthcare system we currently have. Just a couple of weeks ago, House Republicans passed their budget bill, which would kick 16 million Americans off their health care by cutting Medicaid and rolling back Affordable Care Act provisions, while also setting up a major cut to Medicare. Why? You have to ask yourself why. It's all so that billionaires and giant corporations can get a tax break, and we cannot let that happen. They want to let the richest of the rich steal from working American families, just like the big health insurance or pharmaceutical companies do when you need a life-saving prescription drug or a necessary doctor's visit. But here's the thing. America doesn't have royalty. Donald Trump is not a king, and we will not sit back as he tries to let himself and his billionaire buddies steal from us and ignore our Constitution. So as we collectively organize and mobilize, let's keep fighting back against Trump's attacks on Medicaid and for a universal healthcare system that actually provides healthcare for everyone. Medicare for all is not just possible, it's necessary. And you are the agents of change that make the possibility a reality.